Good afternoon, everyone. I would like to talk to you about the differentiation between MS and vascular brain lesions on 7 Tesla, on which we applied a new technique called Flare Star, and you can see an example on this slide. MRI has a high sensitivity for the detection of white matter lesions in multiple sclerosis. However, the specificity is rather low because there are other vascular and neuroinflammatory disorders that mimic MS at MRI. Especially in the clinical situation, it can be extremely difficult to differentiate MS from vascular white matter lesions that are often caused by small vessel disease and are associated with increasing age and hypertension. In 2012, Satie and colleagues introduced a new MRI contrast called Flare Star. In this contrast, they combined FLAIR and T2 star sequences, and these images depict MS lesions and vessels in one image. They applied this sequence at a 3 Tesla MRI scanner, and we thought if we move to a 7 Tesla scanner, this creates advantages, since the 7 Tesla FLAIR sequence has an increased signal-to-noise ratio and spatial resolution, and has proved to increase lesion detection in MS patients. Also, because of the increased susceptibility effects at the T2 star sequence at 7 Tesla, it is able to visualize small vessels without the use of contrast enhancement. This led to the following aim of our study: to implement the Flare Star technique at 7 Tesla MRI and to investigate whether the 7 Tesla Flare Star can help in the differentiation between MS and vascular lesions. We included 16 MS patients from our own database, the high-field MRI and MS study. These were 10 female and 6 male patients with a mean age of 50.5 years. We also selected 16 patients from the SMART study from the University Medical Center in Utrecht. These are patients with vascular disease or vascular risk factors. And these were 6 female and 10 male patients with a mean age of 50.9 years. And the groups were selected based on age matching. All the subjects were scanned at the 7 Tesla MR system, and we selected the 3D FLAIR images for the detection of lesions, as you can see here. And we also selected the T2 star images for the depiction of the vessels. We multiplied them into one single image, which depicts the lesions and the vessels in one image. The images were rated by 2 raters in consensus, and we categorized all the lesions into different white matter and gray matter lesion types. We also assessed the presence of a central vessel within a lesion because it is known that